Welcome to Leading Experts. I'm Jolene Benoit. For most of us, a visit to the dentist means cleaner teeth and a brighter smile. But as recent studies suggest, there may be a link between gum disease and heart disease, and it makes that visit even more important. With us today is your local dentist, Dr. Greg Carroll. Hello, Dr. Carroll.
Hello, Jolene.
Great to have you joining us.
Thank you.
Doctor, how do we relate a healthy mouth with a healthy heart?
Well, basically, when people have gum disease, their levels of bacteria, levels of inflammation start rising in their mouth, and it gains entrance into the rest of their body. It can affect all sorts of areas, other diseases. Absolutely. And there's a recent study show that there's an increased incidence in these diseases, heart disease, including heart attacks, high blood pressure, strokes, prostate cancer, diabetes, and in pregnant mothers that have periodontal disease, low birth weight, and preterm babies.
Boy, this can be really a very
serious consequences.
Very serious consequence.
Absolutely.
How do I know, doctor, if I have gum disease?
Well, there's some important signs or symptoms to look for. Gums that are red or swollen, bleeding when you brush or you floss your teeth, gums that recede or pull away from the teeth, or developing spaces in between the teeth, persistent bad breath, a change in the way your teeth fit together, or a change in the way partials fit.
And once you determine, doctor, that a patient comes in and they have some of these symptoms and you say, okay, we've got periodontal disease, what's the first thing you do?
Well, first off, we want to educate the patient so they understand what's going on, understand how to take care of it at home. We do therapy in the office with the latest technologies, ultrasonics, mouth rinses, antibiotic paste, and we also coordinate with the patient's primary care physician if that's needed so that they get the most optimal care available.
So they can really do a lot of self-care at home on their own to help
and that's
at least manage this problem.
It's very important. It's a very important part of it, yes.
Well, you must have some stories to tell us about some folks who have come in and who had this disease and that you have helped them manage their periodontal disease.
Yes, I have one patient that started coming to me in her early 30s. Her gums bled. She didn't floss her teeth. Her mother had actually lost all of her teeth because of gum disease. So I explained to her, we started educating her. We've been seeing her on a regular basis for 25 years. And 25 years later, she has all of her teeth and has no signs of gum disease. Her gums don't bleed. She's taken quite a different course from what her mother had.
So when we look at this picture, doctor, and you say, hey, she looked like very much on the right side where the disease has taken over, and the left side is healthy. She looks more like
much more healthy now. Yeah, you know, she had some bone loss, but a lot of bleeding. If she wouldn't have stopped things, she would have ended up like her mother and lost all of her teeth.
All right. Well, doctor, very obviously, we thank you for all the education you give us, but mostly for helping us with our overall health and well-being. Great to see you again, Dr. Carroll.
Thank you.
If you would like a complimentary consultation with Dr. Greg Carroll, call 281-980-7777, or you can go to the website, InStyleSmiles.com.